Welcome back to our channel, everyone. Today we have an incredibly important and informative video for you. We're diving deep into the top 10 chronic diseases that significantly impact our elderly population. These conditions are not just medical terms, they affect the daily lives and well-being of millions of older adults around the world. In this video, our goal is to educate and raise awareness about these chronic diseases. We'll discuss their causes, symptoms, risk factors, and how they can be managed or prevented. Whether you are an older adult yourself, a caregiver, or simply someone interested in understanding these conditions better, this video is for you. By the end of this video, you'll have a comprehensive understanding of these prevalent conditions, and hopefully, you'll feel more equipped to handle them or support your loved ones who might be affected. So, let's get started on this crucial journey of knowledge and awareness. Chronic diseases are long-lasting conditions that often require ongoing medical attention. They can limit daily activities and significantly impact the quality of life. In the elderly population, these diseases are particularly prevalent and can complicate the aging process. According to the Centers for Disease Control and Prevention, approximately 80% of older adults have at least one chronic disease, and 68% have two or more. The reasons behind this high prevalence are multifaceted. Aging naturally brings about changes in the body that can make it more susceptible to chronic conditions. Additionally, lifestyle factors such as diet, physical activity, and smoking history play a significant role. In this video, we will explore the top 10 chronic diseases that most commonly affect older adults, providing insights into their causes, symptoms, and management strategies. Understanding these diseases is the first step towards better health and well-being in our later years. By being informed, we can take proactive steps to prevent or manage these conditions, ensuring a higher quality of life. So, let's delve into each of these diseases, starting with one of the most common cardiovascular diseases. Cardiovascular diseases encompass a range of heart and blood vessel disorders, including coronary artery disease, heart failure, and hypertension. These conditions are leading causes of morbidity and mortality among the elderly. The primary causes of cardiovascular diseases include atherosclerosis, high blood pressure, and lifestyle factors such as poor diet, lack of exercise, and smoking. Symptoms of cardiovascular diseases can vary, but often include chest pain, shortness of breath, and fatigue. Risk factors include age, family history, high cholesterol levels, and diabetes. It's crucial to recognize these symptoms early and seek medical advice to manage the condition effectively. Prevention strategies for cardiovascular diseases involve lifestyle modifications such as a balanced diet, rich in fruits and vegetables, regular physical activity, maintaining a healthy weight, and avoiding tobacco use. Medications and surgical interventions may also be necessary in some cases. The impact of cardiovascular diseases on overall well-being cannot be overstated. They can limit physical activity, lead to chronic pain, and significantly reduce life expectancy. However, with proper management and lifestyle changes, many people can live fulfilling lives despite these conditions.
I was diagnosed with heart disease a few years ago. It was a tough time, but with the right treatment and lifestyle changes, I've been able to manage it. I still enjoy my walks in the park and spending time with my grandchildren. It's all about making the right choices every day.
Arthritis is another common chronic condition affecting the elderly, characterized by inflammation of the joints. The most prevalent types are osteoarthritis, which results from wear and tear of the joints, and rheumatoid arthritis, an autoimmune disorder. Arthritis can cause significant pain, stiffness, and swelling in the joints, leading to decreased mobility and quality of life. The causes of arthritis can be varied. In osteoarthritis, the cartilage that cushions the ends of bones in your joints deteriorates over time. In rheumatoid arthritis, the immune system attacks the lining of the joints. Risk factors include age, family history, previous joint injuries, and obesity. Managing arthritis involves a combination of medication, physical therapy, and lifestyle changes. Pain relievers and anti-inflammatory drugs can help manage symptoms, while physical therapy can improve joint function. Maintaining a healthy weight and staying active are also crucial in managing arthritis symptoms. The impact of arthritis on daily life can be profound. Simple tasks like walking, climbing stairs, or even holding a cup can become challenging. However, with proper management and support, many individuals with arthritis can lead active and fulfilling lives.
Taking care of my mother, who has arthritis, has been a journey. We've had to make adjustments at home and find the right balance of medications and physical activities. But seeing her smile when she can move without pain makes it all worth it. It's about finding what works for each person and being there for them every step of the way.
Chapter 4. Diabetes. Diabetes is a chronic condition that affects how your body turns food into energy. There are two main types. Type 1, where the body doesn't produce insulin, and Type 2, where the body doesn't use insulin properly.
Type 2 diabetes is more common, especially in older adults, and is often linked to obesity and a sedentary lifestyle. Symptoms of diabetes include increased thirst, frequent urination, extreme fatigue, and blurred vision.
Risk factors include age, family history, high blood pressure, and high cholesterol levels. Early detection and management are crucial to prevent complications such as heart disease, kidney damage, and nerve damage.
Prevention and management strategies for diabetes focus on maintaining a healthy diet, regular physical activity, and monitoring blood sugar levels. Medications and insulin therapy may also be necessary for some individuals.
Education and support from healthcare providers are essential in managing this chronic condition. The impact of diabetes on overall well-being can be significant. It requires constant monitoring and lifestyle adjustments, which can be challenging. However, with the right management plan, individuals with diabetes can lead healthy and active lives. Chapter 5. Respiratory diseases. Respiratory diseases, including chronic obstructive pulmonary disease, or COPD, and asthma, are common among the elderly. These conditions can cause breathing difficulties, chronic cough, and reduced lung function.
Smoking is a major risk factor for respiratory diseases, along with environmental pollutants and genetic factors. Symptoms of respiratory diseases can include shortness of breath, wheezing, and chronic cough.
Risk factors include smoking history, exposure to secondhand smoke, occupational hazards, and a family history of respiratory conditions. Early diagnosis and management are crucial to improve quality of life and prevent complications.
Prevention strategies for respiratory diseases involve avoiding smoking, reducing exposure to pollutants, and maintaining a healthy lifestyle. Treatment options include medications, inhalers, and pulmonary rehabilitation. In severe cases, oxygen therapy may be necessary.
The impact of respiratory diseases on daily life can be profound. They can limit physical activity, cause chronic fatigue, and lead to frequent hospitalizations. However, with proper management and lifestyle changes, individuals with respiratory diseases can improve their quality of life and maintain their independence. Chapter 6. Alzheimer's disease and dementia. Alzheimer's disease and dementia are progressive neurological disorders that affect memory, thinking, and behavior. Alzheimer's is the most common cause of dementia among older adults.
These conditions can significantly impact an individual's ability to perform daily activities and maintain independence. The exact causes of Alzheimer's and dementia are not fully understood, but factors such as age, family history, and genetics play a role.
Symptoms include memory loss, confusion, difficulty with problem solving, and changes in mood or behavior. Early diagnosis is crucial for managing symptoms and planning for the future.
Prevention strategies for Alzheimer's and dementia focus on maintaining a healthy lifestyle, including regular physical activity, a balanced diet, mental stimulation, and social engagement. While there is no cure, medications and therapies can help manage symptoms and improve quality of life.
The impact of Alzheimer's and dementia on overall well-being is significant. They can lead to loss of independence, increased caregiver burden, and emotional distress. However, with proper support and management, individuals with these conditions can maintain a good quality of life for as long as possible. Chapter 7. Osteoporosis. Osteoporosis is a condition characterized by weakened bones, making them more susceptible to fractures.
It is particularly common among older adults, especially postmenopausal women.
The condition can lead to serious complications, including fractures of the hip, spine, and wrist.
The causes of osteoporosis include a decrease in bone density due to aging, hormonal changes, and a deficiency in calcium and vitamin D.
Risk factors include age, gender, family history, low body weight, and a sedentary lifestyle.
Early detection through bone density tests is crucial for preventing fractures.
Prevention and management strategies for osteoporosis involve a diet rich in calcium and vitamin D, regular weight-bearing exercises, and medications that strengthen bone density.
Fall prevention measures, such as home safety modifications, are also essential to reduce the risk of fractures.
The impact of osteoporosis on daily life can be significant.
It can limit mobility, cause chronic pain, and lead to a loss of independence.
However, with proper management and lifestyle changes, individuals with osteoporosis can reduce their risk of fractures and maintain an active lifestyle. Chapter 8. Cancer. Cancer is a group of diseases characterized by the uncontrolled growth of abnormal cells. It is a leading cause of death among older adults, with the risk increasing with age. Common types of cancer in the elderly include breast, prostate, lung, and colorectal cancer. The causes of cancer are multifactorial, including genetic mutations, lifestyle factors, and environmental exposures.
Symptoms vary depending on the type and stage of cancer, but can include unexplained weight loss, fatigue, pain, and changes in skin or bowel habits. Early detection through regular screenings is crucial for successful treatment. Prevention strategies for cancer involve maintaining a healthy lifestyle, avoiding tobacco and excessive alcohol consumption, and regular screenings for early detection.
Treatment options include surgery, radiation therapy, chemotherapy, and targeted therapies. Supportive care and palliative care are also essential for managing symptoms and improving quality of life. The impact of cancer on overall well-being can be profound. It can cause physical and emotional distress, affect daily activities, and lead to significant financial burden. However, with early detection and appropriate treatment, many individuals can achieve remission and maintain a good quality of life. Chapter 9. Stroke. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. It is a leading cause of disability and death among older adults.
There are two main types of stroke: ischemic, caused by a blockage, and hemorrhagic, caused by bleeding in the brain. Symptoms of a stroke include sudden numbness or weakness in the face, arm or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, and difficulty walking. Risk factors include high blood pressure, diabetes, smoking, and a history of heart disease.
Prevention strategies for stroke involve controlling risk factors through a healthy diet, regular exercise, maintaining a healthy weight, and avoiding tobacco use. Medications to control blood pressure, cholesterol, and diabetes are also essential. In some cases, surgical interventions may be necessary. The impact of a stroke on daily life can be significant. It can lead to physical disabilities, cognitive impairments, and emotional challenges. However, with early intervention and rehabilitation, many individuals can recover and regain independence. Chapter 10. Depression. Depression is a common mental health condition among older adults, characterized by persistent feelings of sadness, loss of interest in activities, and changes in appetite or sleep patterns. It can significantly impact overall well-being and quality of life.
The causes of depression in the elderly can include medical conditions, medications, loss of loved ones, and social isolation. Symptoms include persistent sadness, fatigue, difficulty concentrating, and thoughts of death or suicide. Early diagnosis and treatment are crucial for managing symptoms and improving quality of life. Prevention and management strategies for depression involve maintaining social connections, engaging in regular physical activity, and seeking mental health support.
Medications and therapy can also be effective in treating depression. Support from family and caregivers is essential in managing this condition. The impact of depression on daily life can be profound. It can lead to a loss of interest in activities, difficulty performing daily tasks, and increased risk of other health conditions. However, with proper treatment and support, individuals with depression can achieve a better quality of life and regain their sense of purpose and joy. As we wrap up this comprehensive look at the top 10 chronic diseases affecting the elderly, it's important to remember that knowledge is power. Understanding these conditions can help us take proactive steps to prevent them or manage them more effectively. If you or a loved one is dealing with any of these chronic diseases, know that you are not alone. There are numerous resources and support systems available to help you navigate these challenges. We encourage you to seek medical advice and support if you or your loved ones are affected by any of these conditions. Early detection and proper management can make a significant difference in quality of life. Don't hesitate to reach out to healthcare professionals, support groups, and community resources for assistance. Thank you for watching and joining us on this journey of education and awareness. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more informative content. Together, we can promote better health and well-being for our elderly population.